So what did your lawyer suggest you to do?
Well, basically, he told me to flee the country. Welcome back to Second Opinion with Dr. Jose Haggard and
Virgil.
And today we're going to talk about something I've been asked for years. So in 2008, I published this book, Demystifying Steroids, where I talk about the science behind what I was doing between 2003 and 2007. When I wrote the book, there was just all of this misinformation and myths surrounding steroids, specifically testosterone. So anabolic steroids to be specific, not corticosteroids. And it was such a difference in what I found to be true and what the misconceptions were. And so I had my dad that always did this trick when I was a kid, where you bend your finger, then you do the thumb thing,
and you pull the thumb out, or the ear thing too.
And I'm not nearly as good at it as he did. He must have done some mirror practicing. But so I had him take a picture of his fingers doing this. Those are his fingers.
Oh, that's cute. I love your dad, by the way. Great guy.
He's a great guy.
Yeah, he is.
This episode is about how I wrote the book, why I wrote the book. So I had a visit from the DEA when I was in clinical practice, and they asked if they could speak to the doctor, and I came and spoke to them after I was done with patients, and they said, we want to talk about how many prescriptions of testosterone you're writing and why. And I responded with, well, I specialize in testosterone, and I get a lot of referrals from my patients. I never even advertised at that time. But I had a lot of patients that were coming to me for testosterone because the other patients, I believe, were getting good results. And also they knew I was very thorough and that I knew what I was doing, especially with preventing or controlling any sort of problems that could happen with testosterone. And when I say problems, to be specific, not heart disease, not prostate cancer, but other metabolic conversions like estrogen or DHT, and even blood products, because one of the side effects of testosterone can be increase in your red blood cells or hematocrit, and it makes your blood thicker than normal. But I got really good at managing and even preventing those because I monitored my patients all the time. I saw my patients more frequently than most other doctors that were doing the same thing I was doing. But at that time, there actually weren't a lot of doctors doing what I was doing in my area. The only time I talked to these doctors when I would go to the A4M meetings or other organizations that were showing the science behind testosterone treatment, other anti-aging treatments. And I went to all these seminars. I even became board certified in several different programs, including clinical densitometry and the A4M. And even then, that's where I would talk to like-minded doctors who were at these national conferences or even worldwide conferences. And that's when I would talk to them about, how often do they actually monitor their patients and so forth, because the studies don't tell you that. And at the time, these were all still newer therapies that were really getting into clinical practice, even though testosterone is super old, and yet it just wasn't prevalent. I think because we talked about before, older doctors just had a stigma with testosterone. It's a steroid. Oh my gosh. Well, there's lots of steroids in medicine. Mm-hmm. Most hormones are steroids. So with that, the DEA comes to my office and they're asking me about why I prescribe so much testosterone. And I say, well, I have this list of symptoms, the Adam questionnaire, that I have them fill out if they're older. And especially because the majority of what I was seeing at the time when I first started was diabetic patients. And I was also trying to, again, look at the cause of their diabetes. And again, motivation, exercise can be a large portion of problematic blood sugars. And so I would screen my male patients with the Adam questionnaire or just ask them those questions. And I found so much benefit in it that I was always looking, I think, for testosterone opportunities in my patients that might benefit them. So I was explaining this to the DEA agents that visited my office, and they said that they were impressed. And they asked if they could bring back their supervisors and if I could explain it to their supervisors. I said, sure. So the next time they came back, though, we scheduled the time they were coming back, and I actually made a presentation on the whole thing. Like, okay, this is it's a natural occurring substance, and these are the questionnaires that have been shown in validated studies that testosterone can help with these conditions. And from that, the supervisors even said, wow, that was really informative. Can I bring back my manager? I'm like, well, sure. So I ended up doing this presentation like 4 times to the DEA. And it wasn't an elaborate presentation. It was just conceptual. I mean, I had some...
It's facts and science.
Yeah, and I had a few citations, but not a whole bunch. I took some time to look it up. But, when they had like certain questions, and then one of the questions I loved, I remember when one of the managers came back who wasn't as easily convinced as the others. And he had some counter arguments. Well, what about prostate cancer? What about this? And what about that? And I said, actually, at that time, I had already given testosterone to like a dozen cancer patients, prostate cancer patients specifically. And I said, there's something about that doesn't add up, because I was taught that was a problem, and I gave it with full consent, informed consent to my patients that had prostate cancer, and they signed it. I was real clear about it, and they got better. Their prostate cancer got better. So I said, by the way, what medical school did you go to?
Oh, you asked him that?
Yeah.
And what did he say?
He didn't go to medical school.
He didn't. I knew it. I knew it.
But I was impressed that he even knew this concept that prostate causes.
So he probably
causes prostate cancer.
He probably just did what he was taught, like that one PSA thing. Like he probably is just going by those rules and didn't
I don't know how
ask.
DEA agents are trained, but I'm going to guess it was like a crash course in whatever they're investigating. Maybe like weekend seminar or something.
Think we could get a DEA guy here to interview?
That would be interesting.
Yeah.
Yeah.
Well, let's try to find one. That might work. Any DEA agents that want to come on here so we can ask questions and interview, we would love to. So
I would love to know what you're educated when you go interrogate doctors about testosterone.
Yes, please let us know. We would love that.
That would be great. That would be great.
I'm going to find you. I will too.
So I talked to them, and this went on for months. Like on and off, my manager wants to come or whatever, and then maybe 2 weeks. I'm like, sure, we can do that in 2 weeks.
So the DEA guy had to bring his manager now?
Yeah, so it was like,
oh my God.
So it went like 4 levels deep.
So it went to the next higher. Because
and then what's funny is that every time I had like the audience.
You won the argument. You basically won.
I think the last time I did it, I had like 6 DEA agents in my office,
and they were all trying to come at you to try to make you wrong, but you proved everything and backed it up with science and proof.
Well, and also the presentation kept getting better because every time
you got better at doing it.
Well, they had questions. It was like, there's a study. I'm like, I don't remember who it was, so I couldn't look it up on the fly. But then I started like organizing my thoughts and getting some stuff. But then the more questions they asked, the more like the rabbit hole went down. Or I went down the rabbit hole, I should say, in order to what? That's a good question. I remember an article, but let me
back it up and show you.
Let me organize it step by step. Right?
Yeah.
Step by step. And then my attorney contacts me and says, "Hey, and I told my attorney about this in the beginning, and because he was the one that did the consent forms.
Yeah.
I'm like, hey, interesting. The DEA came and visited me, and I said, is there something I should be worried about? And he said, well, I mean...
Well, yeah, it's a DA.
Well, he said, did they charge you with anything? I said, no, they didn't charge me with anything. And so I said, all right. And from there, I asked the DEA, do you have any more questions? Is there anything else? And I mean, these are all, a bunch of DEA agents that went out the door nodding, like, okay, that makes sense.
And also never did practice.
And never went to medical school.
Yeah, but okay.
And... then basically my attorney calls me and says, hey, I thought you said you were like getting good, communication with the DEA, and you said that they were receptive to what you were telling them and you were showing them the research.
So in front of you they were good, and behind closed doors they were assholes, right?
Somehow my presentations were ineffective.
Wow, after you proved them all wrong and they didn't charge you for anything.
So for 3 months, I'm educating the DEA, and my attorney says, wow, he says, they're going to move forward and they're going to charge you. I said, really? And he said, yeah. He says, they're going to charge you for inappropriately prescribing testosterone. I said, I can't even wrap my head around that. I said, so I'm a naturopathic medical doctor in good standing with my board. I've got 2 DEA numbers because I had 2 locations, and most doctors don't even know that. You're supposed to have a DEA number for each location if you store any medications at those locations, which I did. I always kept like antibiotics and different things on hand. So when somebody came in, I didn't have to wait for a pharmacy or whatever. I could say, hey, I got this right here. I can sell it to you right now. You can get started on this like ASAP. So I always kept like, especially emergency medications. I kept other medications that I just used commonly that a lot of pharmacies didn't keep in stock. So I had a dispensary in my practice as well. So I had, basically a separate room that had all these medications in it. And from there, I told my attorney, I said, yeah, I thought things were going well. And he said, well, they're not going well. And they're going to charge you with doing this. And I said, okay, so again, going through the requirements, I had a valid medical license. I had an active DEA number with no problems. I had a patient-doctor valid relationship. In fact, most of my patients I saw the first visit for an hour and a half. Like, that's a pretty hard thing to say I didn't have a doctor-patient relationship when I sat with every new patient for like an hour and a half.
Yeah.
And then most of my follow-up patients were like 30 to 45 minutes. So it's not like I'm running through the doors,
So at the very end of outcome, what happened? After the lawyer said all this, what happened?
So the other thing is testosterone is within my scope of practice as a naturopathic medical doctor in Arizona. Oh, sorry, one more layer. I did blood work on everybody that I prescribed testosterone to.
Oh, so you did a blood test as well? Because
that's the blood test.
So is that the right way to do it?
Everybody.
Is that the right way to do it versus this PSA test?
Well,
is to do blood work?
At that time, I was even doing the PSA test because I didn't know it was
to
nonsense.
Back your shit up.
Well, I didn't know it was nonsense.
At that point.
This is 2005.
Okay.
Right.
So you're doing the rules and regulations, and then you were doing exactly what you did by the book, and you were doing a blood test, and they still busted your ass.
Well, and then, again, it's in my scope of practice, meaning as a naturopath, I'm allowed to prescribe that. And testosterone is also a natural substance.
Yeah.
So it's like really in my scope of practice.
Yeah.
And then he says, no, they're going to say that you were prescribing testosterone inappropriately. And I'm like, wow, that's crazy.
That is.
And I had been doing it for years.
And then suddenly they just...
It was sudden because it was after the Jose Canseco thing, after everybody's worried about sports.
And then Bobby Vanilla bonds.
Yeah, steroids in sports. Now the government somehow needs to look like they're doing something about it.
So, was it just you that got in trouble?
No. They prosecuted lots of doctors and pharmacists.
That studied that
were doing it.
Have you ever tried to get with some of those doctors that also got in trouble and try to have like a class action lawsuit against them? I would.
Well, in the beginning, but it didn't work out. And so my attorney says, look, do you have all this information together so I can defend you? Because if they come and arrest you, like, we're going to have limited access to, like, all your, you're not going to have a computer. You're not going to have the internet. We're going to lock you up. Like, do you have all this information that I can guide you? You can guide me through it and say, it was this study, this study, this study. I said, no, this is like a cumulative cumulative education I've given myself and all these seminars.
It took me 20 fucking years to learn that shit.
I mean, after medical school.
Yeah.
And basically, the majority of everything I was taught in medical school on this topic was incorrect.
Was false, incorrect.
And so I'm redoing it, and I felt like a pioneer at the time. And there was no book like this to guide other physicians or even patients on testosterone therapy. Everything, the majority of testosterone therapy in the public arena was bodybuilders.
Yeah.
Bodybuilders were amazingly knowledgeable about it, but they weren't really knowledgeable all the time about, having too thick of blood, the estrogen conversion, how to prevent testicular atrophy or even rescue testicular atrophy. Because when you take testosterone, you have a thermostat in your brain that says, hey, you have lots of testosterone in your system, so we're going to quit making testosterone, and then your testicles quit making testosterone, and if you don't use it, you lose it, and so your testicles will shrink. Also a potential problem with testosterone. But if you know what you're doing, you can avoid all of that.
So I have a question. If you take testosterone, your balls shrink, right?
If you take testosterone by itself, and depending on the dose.
But I don't understand, because if your balls produce testosterone and then you're taking testosterone, why would they shrink? I'm confused.
Because you don't use it, you lose it. So your testicles quit making testosterone because you have testosterone in your system already.
Okay.
Because you're taking it now.
Yeah, but sometimes if it doesn't produce enough, don't you have to take it anyways?
Sometimes.
But then your balls shrink, and then it doesn't produce it.
That's the caveat or the catch-22 of testosterone therapy is you need to be aware of that side effect.
So your lawyer couldn't get all the evidence and all the stuff because a lot of it is knowledge in your mind, right?
Right. I took years to accumulate my knowledge and put it into practice and to actually see what parts made sense clinically, because not everything you read makes sense.
Yeah, and there's no way he's going to be able to take all of the knowledge you've known your whole life. That's impossible.
Well, definitely not the stuff I had learned in the last few years, because there was nobody else doing what I was doing.
Yeah, makes total sense.
Hardly anybody except Dr. Abraham Morgenthaler at Harvard.
So was your attorney like annoyed with you or frustrated because he couldn't get the point across like you were trying to do? Because literally you proved yourself, and you're still wanting to bust you. So like, was he getting frustrated too with you?
Well, he was asking me, he's like, what about the presentation that you gave the DEA? And I said, oh, that was like high-level view presentation. That was, with a few details. I said, if I'm going to have like a step-by-step defense and ironclad...
Take years.
I said, it's going to take me a while to put that together.
But he
said, you don't have a while.
Yeah,
you're not going to have the resources. And if you do, you're going to be in jail.
And then you won't be able to...
While you try to figure out your defense.
And you wouldn't be able to figure it out in jail because you won't have all the context and all the stuff you need.
Yeah, he said, no laptop, no internet. So I said, okay, well, what do you suggest I do? I said, it's going to take time. I said, but the evidence is there. He's like, you're confident in it? I said, absolutely. I know what I'm doing. I'm doing it in clinical practice, getting great results. No one's having problems. And he said, well, I'd go find a country that doesn't have extradition laws and take all the time you need.
Wow. So what did your lawyer suggest you to do?
Well, basically, he told me to flee the country.
And that is our episode for today. And you guys, thank you for watching. We'll see you next time.
Follow my podcast on drjessehaggard.com.